Right. My chosen AACN essential is interprofessional partnerships. This is for South College, Nursing 5110. And again, I'm Heidi Childs. What are interprofessional partnerships? Interprofessional partnerships are AACN Essential 6. Excuse me. Interprofessional partnerships are intentional collaborations between healthcare professionals. This includes nurses, doctors, pharmacists, social workers, and others who deliver comprehensive patient care. The AACN describes nursing knowledge and expertise as uniquely able to contribute to the intentional work within teams and in concert with patient, family, and community preferences and goals. I've chosen to highlight the story of Paisley Miller, a patient who was in the cardiac ICU at Primary Children's, whose story is a great example of why interprofessional partnerships are vital to good outcomes. This is a picture of Paisley that really demonstrates interprofessional partnerships. You have her nurse, the ECMO nurse, the respiratory therapist, the nurse practitioner, her mother, and a couple other people transporting her in the hospital. Subcompetency 6.1 says communicate in a manner that facilitates a partnership approach to quality care delivery. A breakdown in this communication results in fragmented care, and the risks of fragmented care are huge. According to recent data, nearly 30% of patients experience care fragmentation. Errors in communication between healthcare providers contribute to 70% of medical errors. Next is subcompetency 6.2. Perform effectively in different team roles using principles and values of team dynamics. So, this is about implementing interprofessional partnerships. We all want to have them, but how do we actually go about creating these intentional interprofessional partnerships? First is education and training. Develop and offer training programs that focus on teamwork, communication, and collaborative practices. I recently attended a transport conference that did a great job of this, um, particularly in reference to Paisley's case. There are special considerations for transporting a child with a Berlin heart, which you can see she has in this photo. Um, Next is regular meetings. Schedule and conduct regular team meetings to discuss patient care, share updates, and align on goals. My example for this is daily rounds. Daily rounds are a planned time where every member of the care team gets together to touch base on the patient's plan of care. So that means the ICU physicians, the surgeons, the nursing team, the transplant team, um, dietitians, social work, and child life. I included this picture because it also includes patient families, and Paisley's dad created this 3D printed Berlin heart for her doll so that she felt like she could relate to something. And I just thought that was a really creative way of um, bringing everything together in a way that a child could understand. Next is subcompetency 6.3. Use knowledge of nursing and other professions to address healthcare needs. Leverage roles and abilities of team members to optimize care. So, this is talking about a knowledge share between every provider. This is a picture of cardiac surgeon Eric Griffiths, who did all three of Paisley's cardiac surgeries during the course of her ICU care. So, knowledge share between providers. These providers include surgery, cardiology, nephrology, pulmonology, the ICU intensivist, behavioral health, infectious disease, and the transplant teams. Each of these specialties have expertise in their piece of the puzzle, and we need all of those to facilitate a good outcome for patients that are complex like Paisley. Next is subcompetency 6.4. Work with other professions to maintain a climate of mutual learning, respect, and shared values. My example for this subcompetency was the transplant team. The transplant team works with donor or organ procurement organizations all over the nation. So there are organ databases for potential recipients, and they are ranked by medical criteria and urgency. So they need to be the right match for the organ um, and be listed 1A as the most in need. And then also just the smaller details like, is it the right size of organ? I know with Paisley's case in particular, there were a few potential donors that once they looked into it more, they found those organs would have been too big for her because she was just a toddler at the time that she needed a transplant. So her little sign says after 285 days in the hospital, Paisley is finally getting her organs. Next is subcompetency 6.2b. Delegate work to team members based on their roles and competency. My example for this subcompetency is pharmacy. This is a picture of Paisley fairly soon after her transplant. Um, and for transplant patients, they require immunosuppressant meds that are timed really strategically so that they're at a therapeutic level so that their body does not reject the new organ. Um, so as the nurse in this case, I'm going to defer to the expertise of pharmacy. I'm going to, they say give the CellCept right at 8, I'm going to give it right at 8. If they say draw this tacro level at 8:30, I'm going to draw it at 8:30 so that they can dose everything correctly based on their expertise and not cause an organ to be wasted when it could be life-saving for a child like Paisley. Next is subcompetency 6.2i. Reflect on how one's role and expertise influences the team performance. And 6.2d, which says recognize one's uniqueness as both a person and a nurse and how this contributes to working relationships. So, my example here is a picture of Paisley with her favorite ICU nurse, Candace. Candace was a really great personality and temperament match for Paisley, and Paisley really trusted her. So she could do all of Paisley's dressing changes with no sedation, and she would get Paisley up to do all of her PT when other nurses, couldn't get her to do that on some hard days. And um, so it was best for the outcome and best for nursing as well that this good fit was able to be together anytime that they could so that there was consistency and continuity in care and that they could make the most progress as possible. This other picture is a picture of all the nurses or some of the nurses that took care of Paisley in the ICU. After she went home, she was able to come to the fall festival with us, so that was really fun. Next is subcompetency 6.4d. Collaborate with interprofessional team members to establish mutual healthcare goals for individuals, communities, or populations. The most obvious community to me, particularly for a child, is their family. So this is Paisley's family, her mom and dad, her two brothers, and her in the middle. Um, and her mom was so great about being a advocate for Paisley and a really committed and active part of the care team. And she's actually pursuing nursing school now that Paisley's time in the hospital is over because she was just so dedicated and so good at doing that. Something I really loved at one of the conferences I recently went to that I thought comes back to this collaborate for the good of the family. It was the theme of leave your logo and your ego at the door. So it shouldn't matter whether you are the cardiac surgeon or child life or the dietitian or the transplant nurse or the life flight pilot. Um, we should all be working together for the ultimate goal of the best outcome for our patient, which is hopefully to go home with their families. And in Paisley's case, this was true. Like, she got that goal. It was a very long road. She was in the hospital, I believe, for over a year. But this is actually a photo of her yesterday. She went to her first day of kindergarten. She did not ride that bike. She rode the bus to kindergarten. But I love her story because it's a great example of interprofessional partnerships that were done really well to achieve the best outcome for the patient, which is a kindergartner going to school on her first day. That concludes my presentation on interprofessional partnerships for South College, Nursing 5110. Thanks so much.